All right, hey guys. I'm going to talk to you today about the first half of Chapter 6 of Phantoms in the Brain, Hemispatial Neglect. So it's a concept I'm pretty sure all of us are quite familiar with. But just a reminder, Ramachandran had a patient, Ellen, who had just suffered from a stroke, and upon coming home, her son noticed that she had only actually groomed one half of her body. So she showed as anosognosia, which is a complete unawareness of her condition, but she was totally neglecting the left side of her body and everything, eating included. So, what actually is hemispatial neglect? Um, this is a disorder where, as it sounds, patients will ignore and fail to direct attention to objects in one half of their visual field, almost always on the left. So they now divide it into three categories: personal, dealing with your own body and movements; peripersonal, which is reaching or objects in your immediate vicinity; or extrapersonal, so things that are farther away. Um, of course, some of these patients still show a tacit level of awareness, kind of like blind sight, where, for example, in this image, they see the two images and say, no, it's identical, because they don't see the fire on the left side. But when asked whether they would rather live in the top house or the bottom house, even though they might think it's a ridiculous question, they reliably choose the top house to live in. So, where actually is this in the brain? There's some three regions initially that are super important and critical for understanding hemispatial neglect: the dorsolateral prefrontal cortex, the posterior parietal cortex, and the anterior cingulate cortex, again on the right half of the brain. However, recently, the angular gyrus of the right parietal lobe was implicated as being absolutely critical in patients who have hemispatial neglect. So why though only on the right side? Well, in a healthy brain, both hemispheres attend to the right side of space, where only as the right hemisphere attends to the left side. Which, well, you're wondering why? Because our brains have evolved to adapt to language, and a lot of the language centers are localized on the left half of the brain, so there's less real estate to going into paying attention to our surroundings, whereas the right is where most of that real estate is. And so when you have damage on the right hemisphere, it's more detrimental, and so you see a neglect of the left side. So how do we know if patients have hemispatial neglect? Well, there's a lot of tests. For personal and body related, there's a test like you demonstrate the use of objects like a comb, eyeglasses, or a razor, and then see the degree of symmetry to which people demonstrate this. For peripersonal, this is going to be the tasks all of us are familiar with, like drawing the daisy and the clock, or cancellation tests, as I have pictured here. For extrapersonal neglect, we'll see tests like describing the room around them, or serving tea, or dealing cards. So what's important is, how do we treat it? Well, there's a bunch of different ways, and they're usually used in combination with each other. For example, there's cues such as learning to turn your head or using a pointed finger as a cue, putting bright colored post-it notes on the left side of the things, or as we see in the picture here, prism glasses that shift everything to the right. There's also other tasks like copying tasks, identifying objects on a screen that start from the right and move slowly to the left, and learning to identify those. And there's also reading tasks, which these usually get progressively harder, but also have cues, like identifying objects on the screen, moving to the left, there will be a warning sound or encouragement from the therapist. One thing, though, that's really become important in the treatment recently is examining the relationship with the practitioner. And there is a positive outcome when people have good relationships with their practitioners, and also focusing on themes in these tasks. Like I said, there's a variety of tasks we use, and so when it can help when you condense that all into one theme, such as all of these tasks being around something such as grooming and hygiene. So here's just a um, quick shot of some of the research that I found on it. And with that, I appreciate everything, and Thank you very much for your time.